Hi, everyone. I hope you're all well. Thank you for joining in. And thanks again for making time for this session. Dr. Mercy is here and we're ready to begin. So let's go ahead with today's session. If you have any questions, you can type them in the chat and then we'll come to the Q&A session at the end of the meeting. And also I will share a poll that you can respond to, and we'll reshare the poll again at the end of the meeting for more responses. So if you can see that on your screen, please do respond to the questions we've asked. Today's session is on pet emergencies, and we're going to look at what kind of incidents our pets encounter and try to work our way to how to respond to such and what we should be doing at that time. I can see the responses coming in. Thank you for that. All right, so the poll will stay on the screen for a minute. In the meantime, I will introduce today's session. So like I said, we'll be looking at pet emergencies. Excuse me. We'll be looking at pet emergencies, identifying and managing these situations. And from the cases we've seen a lot, most of the incidents occur during road traffic accidents, so vehicular impact. We also have a lot of high-rise syndrome. This is when cats living in homes that are high above the ground, so mostly in apartments, you find that they'll either accidentally fall off a balcony or a window, or they will sometimes, in some cases, deliberately jump off in either an opportunity they're looking to jump to a lower ground or they're chasing something. And then, of course, there's blunt trauma, where they've been hit by deliberate action, hit by someone or something. We usually find this with people stoning animals, people deliberately hitting animals with sharp objects and cutting them, and such kind of trauma. Then we have poisoning, which is from either animal, plant, and food poisons, so substances that are in our food and in our plants. There are some plants that are highly poisonous to animals, and we should be aware of what they are. Then, of course, there's other occurring toxins, venoms, and poisons around our homes. Either they could be from substances or other things, like chemicals. And what we want to really learn today is the immediate care and the first aid you should do before you call for expert help. Today's guest is the very esteemed Dr. Mercy Barasa. She's a veterinary surgeon from Kenya. She is also the secretary of the Toxicology Society of Kenya, and therefore has quite extensive experience on this subject. And she's also the primary vet surgeon at Petville Veterinary Clinic, which is in Ngumo. For those who don't know Ngumo, Ngumo is off Ngong Road in Nairobi. So I will end the poll here, and I will ask Dr. Mercy to then begin the session. I will restart the poll later at the end of the session, as I said, and then we can take in some more answers. Thank you once again for joining in. Dr. Mercy, I will let you share your screen at this moment, and then we can go ahead.
Okay, thank you so much. Can you hear me?
Yes, very clearly.
Yeah, so thanks, Naomi, for the introduction. And I think we'll just start off the topic. I'm sure you can see my screen there.
Yes, go ahead.
Okay, thank you so much. So today we are going to deal with a topic called handling pet emergencies. And this one we are going to talk based on the cases that we see day to day and what our colleagues also in other clinics that they experience. And I've already been introduced. Thank you so much, Naomi. And I just want to say that I'm so much interested in the topic of toxicology, which mainly deals with cases of poisoning, drug reactions, and drug interactions. So let's start, and I'll start with common pet emergencies that we encounter in our clinics, in your homes, and what we've seen over the years. So most of them that they come, we have seizures or convulsions. We have poisoning cases, and mostly we have poisonings as a result of the foods in the house, the chemicals in the house. We have also other cases of poisoning like from plants, and this one we are going to see later, the types of poisonings that we get. Also, we've seen cases of choking. We've seen severe bleeding whereby maybe an animal has been cut by something or was involved in an accident or was bitten by another animal and is bleeding so heavily. Clients reach and they're not even able to take some control measures of preventing further bleeding even before they reach the clinic. So today we are going to see how we can prevent or control the bleeding even as we are rushing our pets.
Dr. Mercy, we've lost your screen. Sorry, please give her a moment to come back.
Can you see it?
Yes.
Okay. So I was saying we were on number 5, whereby we see cases of wound dehiscence or evisceration and evisceration. This is where you went to the vet, your pet was stitched or underwent a particular operation, but you went home and the wound came apart. We've seen such cases. We also have high-rise syndrome. This is when a cat falls from a height, of a steep height. We've seen cases of fight wounds, snake bites, broken bones, mostly from the car accidents or being stepped on by something, hit by something, or bitten even by other animals to the extent of breaking the bones. We've seen cases of drug overdose. This is in cases where, the cases of drug overdose, we normally see it. The drug overdose, we see it mostly when the clients, they take home medications and they don't follow the instructions. Sometimes we have self-diagnosis clients whereby they see a pet is showing a particular signs and they just go over the counter and buy some drugs. They do give drugs, but they don't know the dose. So you have those adverse reactions and they come to the clinic. We've also seen cases of foreign bodies. Maybe a bone is stuck or a thorn, something foreign. The puppy has swallowed a toy. So these are also the kind of emergencies we've seen. So having read and seen all those, that list of emergencies, as a pet owner, you need to have a first aid kit. You need to have a first aid kit at home, and we are going to share what items what are the basic items that you need to have in your home first aid kit for your pet. So this is just a few. And the kit at home, you need to have a saline solution. This is normally normal saline solution. You can get it readily in a chemist near you. And this saline solution is actually normally sodium chloride. And what it does, it really helps you to wash the dirt and debris from your pet's eyes, wounds, and even other areas. So it is basically good for cleaning. We also have medium dressings. Like when your pet has an injury, you need to also have in your first aid kit some dressings that you use to cover the injury even as you prepare to head to your vet. You need bandages. You need the warm water bottles and the towel. This is basically to retain the body temperature and to keep your pet warm. There are those patients that come to the clinic with hypothermia. This is the case whereby the pet is having temperature below normal. And before they go into hypothermic shock, it is good if you did prevention to prevent it going so down. It will be so easy for the vet to resuscitate when you have maintained the warmth. You need also to have the swabs, the gauze swabs. This is for cleaning up the fluids. Your pet may be producing some fluids, discharging, or even after cleaning the wound, you need the swabs to wipe and clean up. You need also surgical spirit. It is very important to have it at home. You need the latex gloves. These are just common examination gloves that you need because some of the handling, you need to put on gloves to actually handle your pet, especially if it is discharging or oozing. We also encourage that you need to have activated charcoal. These are black tablets that are given also in human beings that have consumed something poisonous. And the role of activated charcoal, it really helps to absorb. It has some chelating mechanism whereby it absorbs the poison or something bad that the animal has consumed even before it gets digested or absorbed into the system. So I'd encourage that in your home, always have some activated charcoal somewhere in your first aid kit. You need a pair of scissors. And in this case, we have cases, especially cats, we've seen they have these foreign objects like a string that is tied around the feet when they were playing, or it is tied around the mouth, and scissors will be of great help. You just easily cut it and you help your animal not to undergo distress. You need a razor. Some wounds or some areas you might need a bit of shaving or cutting something, you really need a razor. You need antibacterial cream. There are those minor wounds that might not necessarily need you to go to the vet, and having some bandaging material, the wound cleaning materials and the antibacterial creams, it can help you to prevent infection for minor wounds. Having said that, we'll have to refer, any case of emergency, we'll have to refer to our kit to make sure that we have everything at home that we need. So we'll continue with our list of common emergencies, and we are going to start with the seizures, convulsions. And these ones we've seen mostly in cases whereby we have a pet, a dog or a cat or any other pet with cases of head trauma. We've seen in cases of even poisoning, and seizures or convulsions normally are the sudden neurologic events that causes your pet to change consciousness and repetitive involuntary movement. You see your pet involuntarily moving, loss of consciousness, like he's not aware of its environment, that is seizures. And the movements are normally very dramatic. Mostly caused by poisons. When your dog or cat is diabetic, especially cases of low blood sugar, growths in the brain, it causes also the animal to show seizures, severe liver damage. because of the toxins spreading in the circulatory system, you end up having seizures. And also we have those animals with epilepsy. They seem to frequently encounter these seizures and convulsions. So what signs do you look for you to tell that the pet is having seizures? Normally they have stiffness. This is a rigid body posture. They are so rigid, they can't flex, they can't relax their bodies. We have jerking or running. They behave as if they are running or paddling reflexes. We also have, they lift their lips, chewing gums, the vocalization. If it's a cat, it will be meowing a lot with a funny sound, and even dogs will be barking uncontrollably. We also have, they can urinate and defecate. Some have hypersalivation. They hypersalivate so much, like in this diagram, you can see this cat is frothing, and even the eyes are so wide, like the cat is not aware of what is happening. And what are we supposed to do when your animal has the convulsion or the seizures? So the first thing, you have to move the pet away from obstacles, because this is an animal that is manifesting symptoms and the animal is not aware, is not conscious of the surrounding. So you have to move any obstacle or any objects that can cause damage. You need also to time the seizure and note all the signs. Remember, this is something that happens very suddenly, so it will be nice that you time and see how long did this episode take? What other signs did I see? This will help you when you get to your vet. You'll be able to document, and he'll be able, with the good history and the pattern of the seizure, it will really help in making the management of the cause of the seizure. After doing this, you have to rush to the vet quickly, because if it is something like a seizure that is not stopping, we definitely need an emergency vet care to give the anti-seizure medication. The second emergency, we see mostly poisoning, and poisoning, common poisoning cases that we've seen. We've seen chocolate poisoning in dogs. Mostly, this we see mostly during festivities, like in December. You are having a party or you're enjoying some chocolate somewhere, and your pet also decided to chew mostly the dark chocolate. We have some medications. Mostly, we've seen cases of aspirin poisoning, paracetamol, brufen, some human topical creams like diclofenac, antidepressants, some cancer drugs. And for cases like human pain topical creams, we know that cats, they really like licking and self-grooming too much. So they can be in contact with your skin, and during their grooming, they lick those, the cream, and they'll get poisoned. So in cases of paracetamol, we've actually seen this case quite common. And this comes with the clients thinking that you can easily give Panadol to your pet, and without following the instructions. And we know cats that they don't process paracetamol well. They normally have a very bad reaction, and it is always a very serious emergency. So also common poisoning that we see are from the household hazards, mostly the anti-bait. You're baiting the rats in the house or something, then the cat gets into contact. Antifreeze, the antifreeze that comes with buying your new clothes or something, those granules, they are poisonous. We have some fertilizers, paints, and even car batteries that contain lead. Lead, we know it is a very poisonous heavy metal. Rodenticides, these are chemicals that kill rats. And this one can happen by either the pet getting it directly or by consuming an already killed rat from rodenticides. We've seen insecticides like organophosphates. They have very bad effects. Molluscicides, these are chemicals that are used to control mollusks, like the snails. Detergents, disinfectants, and even bleach. We've seen cases of poisoning from such. Certain plants like tulips, we have lilies, chrysanthemum. These are mostly potted plants, and we have those like puppies and even kittens. They like chewing on them, and it can turn out to be with a very bad reaction. Some foods like xylitol, alcohol, artificial sweeteners, garlic, and onions, when consumed in large amount, they cause poisoning. We've actually seen a case of marijuana poisoning in a dog, and the signs are not so good. So what are the home manage? How do you manage in case you're suspecting your pet has been poisoned? So what matters is what kind of a toxin or a toxicant. Actually, a toxin is of animal origin. A toxicant is anything chemical, any chemical that is not from animal origin. So it will depend with what kind of the toxin or toxicant, which exposure, is it by skin exposure, is it by consumption, how long, or the time from poisoning until when you are getting your pet, how long has it taken for you to get to know that your pet has been poisoned. So the first thing, you have to rinse with clean warm water, especially for skin exposure. And this has happened with you go to, mostly those who go to the agrovets, you buy something for cows and you want to use it to control fleas and ticks on your pet. You don't follow the dilution mechanisms and you end up having a very bad poisoning on the skin. So if we have skin exposure, in this case, you have to thoroughly rinse with plain warm, clean water to reduce the concentration of the chemical that your animal has been exposed to. You have milk. Milk has calcium in it and it helps to bind some consumed chemicals. So sometimes if your animal has ingested, it is good to give milk. It helps a lot. As I mentioned in our first aid kit, we need to have activated charcoal tablets. And in cases of consumption, like the pet has ingested a chemical and it is within 2 hours, actually 45 minutes, it means that this chemical hasn't left the stomach. So when you give activated charcoal, it will bind and therefore preventing further absorption of the chemical. You have to reduce exposure. Like if your pet is in an environment where you have that hazard or that poison, you have to reduce exposure by making sure you keep your suspected foods in a safe place. If you have to keep medication, you have to keep medication in a secure place, safe place where the pet cannot reach. And also have some good disposal mechanisms, like for garbage, because we see some of these animals, they get exposed from just scavenging. So another type of poisoning or the emergency that we see is choking. We've seen pets come with choking and mostly the owners really panic. They don't know what to do. And choking happens when something gets lodged in the mouth or in the throat. And this is normally life-threatening because it interferes with the breathing pattern of the pet and you can easily lose from suffocation. So the signs, normally your pet will appear so distressed. If it is something that is stuck in the mouth, it will be pawing at the mouth with the leg, trying to remove it or showing that there is something. Rubbing the face against the ground just to try and dislodge gagging or retching, trying to vomit and nothing comes out. You will see hypersalivation, coughing continuously, especially if something is stuck at the throat. You see cyanosis. This is normally the bluing. You see the gums and membranes becoming blue. And this normally comes with the insufficient oxygen that is interfered with, like we don't have enough oxygen circulation. And in this case, you can easily get your animal into shock if you don't act quickly. So what are you supposed to do when your animal is choking? What you need to know to do is, if you can try and remove the object, if possible, that is, if you can. What you need to know is that the animal that is choking might be feeling pain, and if you have to approach your pet, you have to be careful, because even your pet that knows you very well and very friendly can turn against you because of distress and pain. So try to open the mouth of your pet, and if you locate the choking object, try to remove it with your finger. If it is a string that is around the mouth or that is causing the choking, you cut with the scissors. And you use your finger to swipe the object, because when you are not careful, you can push the object further down, and this can even worsen the situation. So make sure you locate the object first before you attempt to remove it. Don't poke your fingers blindly. We have that technique that is called Heimlich maneuver technique. This is whereby you put your pet on your thumbs with the tummy facing. I'll demonstrate. And in this case, you try to press around the rib area, applying some pressure to see whether you can help dislodge the object that is stuck. So this one, if you can't manage, like you are very sure your animal is choking and you're not able to dislodge it, you can't see it. In this case, you'll have to apply the CPR. CPR, it means that you have to, the animal, when it is choking, it will reach a level whereby it loses pulse. And when it loses pulse, it means that you are losing your pet. So if you do CPR, you have to do 120 chest compression. This is compressing the chest continuously, like 120 chest compressions per minute. CPR is actually like you are breathing for the animal. You have to continue compressing the chest even as you are heading to the vet. This one will help in resuscitation and in keeping the heart active and pumping. Another emergency that we see, severe bleeding. And as I said earlier, bleeding happens when maybe your pet has been involved in a fight, cut by something, has been hit by a car, and bleeding can be internal or external. And just to note is that internal bleeding is very difficult to control at home. So, and sometimes it will be hard for you as the pet owner to identify that your animal is having internal bleeding unless you're experienced enough. But we have cases of external bleeding. This is the bleeding that you can see. And in this case, you have to apply a compress of clean gauze. Excuse me, at our clinic, we have a mosque, so don't mind the noise. Yeah, okay. So you apply a compress of clean gauze. Remember our first aid kit, we say that you need to have a gauze. So you have to apply some compression. That is you compress directly over the wound. using a firm or gentle pressure, this will allow the blood to clot. So sometimes bleeding can be so severe that your gauze gets soaked up. And the mistake that we've seen what our clients do is that when the gauze is soaked, they remove and put another one. Ideally, you're just supposed to add another gauze on top of the soaked one so that you don't interfere with the clot that has already formed. So ensure you have the gauze and you just apply directly on top of the wound. Also, especially if the bleeding is on the extremities, you have to elevate your pet, put your pet in an elevated posture such that the wound is above the heart. This one decreases pressure to the injured area. So you will be elevating your pet as you apply pressure so that you decrease the blood pressure, the degree of bleeding will eventually reduce. The other emergency that we see is evisceration or wound dehiscence. Evisceration is whereby the wound gets open and the abdominal organs or internal organs come out of the body wall. And this one happens normally with the pets, dogs or cats eating their suture. Like in this case, we see this dog was, actually this was a case of an umbilical hernia. This dog was corrected for a hernia. We put a collar, but the collar came off and the dog ate the stitches. You can see the wound is gaping, meaning there is a risk of one, the intestines coming out, and also there is a risk of infection. So when you take your pet to the vet and you instructed on what to do at home after the surgery, mostly we recommend that you reduce activity, you keep your animal in a confined place at least for a week. We normally put the e-collar, cone of shame. So if your vet has instructed you to keep a collar for 10 days, please strictly follow that. Also, we have those t-shirts, and even sometimes you have to put some bandages over the wound, especially for dogs and cats with very sensitive skin, or those ones with maniacal behavior that they just bite themselves. This will really help. And if you know that you can't manage the wound at home, we advise that you just let your pet stay at the vet until when the wound is healed, and normally it takes between 10 and 14 days. So for prevention, you have to be diligent about using the Elizabethan collar. Sometimes we modify the t-shirts and bandage for pets with those that are very active. We have those pets that are so jumpy, very active, and the wound can easily come apart. You have to keep checking the wound after the surgery. And sometimes you can have some infection. If you notice your wound is discharging, please consult with your vet. And if your vet is not reachable, you need to have some Epsom salt. Epsom salt is magnesium sulfate. It is very good when you mix with warm water. You don't have actually to use an antibiotic for mild infection of a surgical wound. You just do the magnesium sulfate salt mixed with warm water and you just clean the wound twice a day. This will help to prevent the infection and to promote the healing. As I said, if you know that you have a busy schedule, you'll not be able to monitor your pet, please opt for hospitalization at the vet for close monitoring, close observation, and confinement until your pet is fully healed. And this normally takes 10 to 14 days. So we have highly mobile or highly jumpy pets that are so jumpy that after you've done your stitching and the pet is allowed home, it jumps so much that we form seromas or the fluid blisters around the suture. So if you're at home and you notice some small bumps around the wound, it means your pet is moving so much. You need to confine to prevent further blister formation. Dehiscence, as I said, the wound coming apart, you can see, like in this case, the wound is infected. You can see the discharge, and infection on its own can also cause the wound coming apart, even if the animal is not leaking. So if you notice any discharge, you notice anything amiss, please call your vet immediately. Evisceration, as we said, abdominal content, like the wound can literally come apart and the intestines come out. And the funny bit with our pets, normally they go for the wound, actually they eat themselves, leaking too much, eating. Like we had a case of a dog that was spayed, was released by a vet home on a collar, but the owner decided to remove the collar, thinking that it was distracting the pet. And during the night, the dog ate the stitches and all the intestines came out, and the dog chewed on parts of the intestine, and it was a very complicated surgery to cut the already eaten intestines and stitching back. So just be careful. So sometimes the coming out or the coming apart cannot be necessarily as a result of surgery, but sometimes you have those dog fights or cat fights whereby you have the fight that is so deep into the abdomen that the organs can easily come out. So if it has happened at home, please don't panic. What you need to do is you need to get a gauze, a wider gauze or a clean cloth in warm water, and you just wrap around the organs around the back and tie it. This one will help the intestines or the exposed organs from drying and from getting debris. Yeah, and also will also prevent bleeding. So this one you are doing at home even as you head to the vet, because organs coming out will need to have to be corrected surgically. We have also high-rise syndrome, and this has become so common in our setup. I think it is because of the change in settlement. We are having increase in high-rise building, especially in our surrounding. And we are seeing cases so frequent that we need to really mitigate, because we are losing a lot of pets, especially cats, from the high-rise syndrome. So as we said, high-rise syndrome is when pet injuries that are sustained when cats fall from a steep height. And these cats, normally, they can be used to the environment that you stay on a 6th floor apartment and your cat has never had an incident. But what causes sometimes can be the cat being startled by noise, like making mechanical noise, and being startled, the cat can just fall off. Strong focus on a prey, like a fly is passing or a bird, and the cat is so focused on the prey that it forgets to note the surrounding and slips and falls off. When you leave the windows open without appropriate screening, actually for those who live on the high-rise buildings, you need to secure your windows. You can put a mesh. Your balconies have to be secured to prevent such cases. Also, sometimes when cats are sleeping, they have these involuntary movements when they are sleeping. So when they are sleeping and they are having those involuntary movements, they can easily fall. So the best thing is just to secure. For any case of high-rise syndrome, there is nothing much actually you can do at home. What you just need to do is you rush to the vet as soon as possible, because mostly they fall. You can see a limb broken, but on top of that, we have also internal damage. So don't overdo so much, just rush to the vet as soon as possible. We also have fight wounds as an emergency. You've seen mostly in cats, you've seen in dogs, and for cats, mostly we see in males that are not castrated. When they are going out to look for mates, I think that's where they start fighting for dominance also. And female cats, when they are on heat, we have, like this was a cat called Karumani. The owner just noted, like when she pets at the back, the cat is in pain and she could not even see anything wrong. So when we checked, we could feel that there is a problem on shaving. We saw these bite marks. So fight wounds are also emergencies. They can be so severe, they can be so bad that they become life-threatening. So these fight wounds, as I say, they can be minor or major. And minor wounds can be managed at home. So how you determine whether it is minor or major? Normally it is the degree, the depth of the wound, and also how extended it is. So you have to know that not every scrape or injury requires pet emergency care. There are some bruises, some minor scratches that you can actually treat at home when you have a properly equipped first aid kit. Like for this case, if the owner had a nice first aid kit, these were just superficial marks, and we just managed with the Epsom salts. No antibiotics were used in this case. So if the wounds are bleeding, you stop the bleeding, and you remember we said how you control. You put a clean towel or cloth over the wound, and you apply little light pressure, so that to promote the blood clotting. So sometimes this bleeding, especially in extremities, like you are applying pressure and the bleeding is still so severe that your pressure is not helping. So we have to note that if it is on the lower extremity of the leg, there is a major blood vessel, a major artery called femoral artery, and it is on the medial side of the thigh. So you can just apply pressure there above. It will eventually stop the bleeding, because that is the major artery that causes severe bleeding on the extremities. If it is the front arm, the front leg, lower side that is bleeding, you're trying to put pressure and the blood is still oozing, you just come at the elbow. On the medial side, there is the brachial artery that you will just put pressure, and eventually you'll control bleeding on the lower end. You also clean the wounds. So mostly bite wounds, they contain bacteria that can cause infection. So we know the saliva contains bacteria. And sometimes these fight wounds, you can see it as a small wound, but it is deep and there is so much dirt far inside there. So with cleaning with our saline solution that was in the first aid kit will really help. So even if a fight wound is small, you need to clean it and also bandage it when necessary. Some fight wounds, you can have the dust, the foreign objects that are there. So you use tweezers to pick those foreign materials around the wound and clean it as you bandage. You disinfect the wound, and just to include on our list of the first aid kit equipment, you need also to have the betadine or chlorhexidine. You dilute it, and it really helps to disinfect the wound to prevent the infection. Disinfecting the wound You will reach to the vet when the wound is still fresh and it can be stitched, so that you don't wait and the wound to heal by secondary intention. So you're advised not to rub or use hydrogen peroxide on the fresh bite wounds, because these ones, they delay healing. It interferes with the tissue and it delays healing. After cleaning and disinfecting the wound, you cover up the wound with the bandage. You apply, for you to cover the wound, you have to apply the antibacterial ointment, then you cover with the gauze or with the bandage. Then using elastic tape, you hold the bandage in place. For minor, you can do this routinely until the wound heals, but if the wound is taking long or you suspect the wound is big, just go to the vet. Also consider the E-collar, Elizabethan collar, because after covering the bandage, the pet can go eat the wound and eventually it will come off. For major wounds, you have to rush to the vet immediately. We also have cases of snake bites. This dog was bitten by a snake, and you can see the reaction. You can see the swelling. You can see the hanging tongue, and normally comes with paralysis. So snake bite normally depends on the type of snake. We know there are those venomous snake and non-venomous, those ones that can cause very bad reaction, and others are not. So we have to know that the closer the bite is closer to the heart, the quicker the venom spreads and the life-threatening it becomes. So most times of the snake bite, it causes weakness, sudden weakness, collapse, muscle twitch, leg weakness, hypersalivation, frothing, swelling, and even paralysis. And what to do normally, you have to rinse the wound with water to remove the venom. Keep the wound below the heart and keep your pet still to prevent the venom from spreading. And if the pet is not breathing, please administer CPR. That is pumping the chest at least 120 compressions per minute as you head to the vet. So as the owner, you should not panic, because there are some pets that sense a panic client and they be in distress, and this will promote the spread of the venom. So we have cases of broken bones, and this was also an emergency. Your pet has been hit and it will be showing signs of pain. What you need to do is that seek the vet care as soon as possible and keep your pet as still as possible. You should not give any pain medications unless you are directed by your vet. Pain medication, it masks the problem and it will be hard for your vet to identify. So unless advised, you have to just rush to the vet. Just remember that broken bones, fractures cannot be treated at home, and you should not manipulate or tie with anything. Just rush to the vet. We have the emergencies of drug overdose, and this one normally, as I said, comes with the over-the-counter medication, or when you are many in the family and there is a pet that is on medication, one family member gave in the morning and you come and give even without asking whether the dog was given or the cat was given or not. So you end up overdosing. So if you have overdose, or even sometimes the pets can access the medication, like we had a case of Rimadyl, is a carprofen. The dog, which is a small size, got into a bottle of around 20 tablets and consumed all the carprofen tablets. So the signs, it will depend with the type of medication that you've overdosed, and mostly the signs that come are weakness, lethargy, bloody urine, abdominal pain, abnormal behavior, vomiting, seizures, tremors, and sometimes they die even before they reach the vet. What you need to do is you contact your vet or emergency facility to find out what signs to look for, especially if you know you have given or the pet has just consumed. You have to call immediately. then you should never give medication without approval from your vet. So even if you go to over the counter, make sure that you ask your vet first on the dose. So at home, you need also hydrogen peroxide. This one helps in inducing vomiting. When you dilute it and give orally, it helps to induce vomiting. This will help the dog or the cat to vomit the medication even before it goes into the system. So if your pet consumed the drug and it is unconscious, you should not induce vomiting, because this one can cause the animal to have that reflex of vomiting, and it goes in the trachea, in the lungs, and this will cause a very serious aspiration pneumonia and even death. We have foreign bodies. This is a cat called Happy, who was having a fish hook that was stuck in the mouth. We have also this cat, Mr. Meow, who had swallowed a needle with a very long thread, and the cat was not showing any signs when the owner came, and we insisted on doing an X-ray if she's sure that the foreign body is there. So the foreign body had moved all down. This was the needle with the thread, had moved down, and it was on its way in the small intestine. It had actually left the stomach and at the duodenum, heading to the ileum and the jejunum part of the small intestine. So most of the common foreign bodies that we see: balloons, batteries, fishing hooks, socks, rubber bands, bones, corn cobs, balls, sticks, and toys, especially in puppies, toys, and kittens, we see a lot. So the symptoms, normally you'll see lip licking, drooling, hiding, vomiting, reduced appetite, abdominal pain, and even diarrhea. So what to do is you contact your vet immediately if you have seen or you suspect your pet has eaten something foreign. If you see, like in this case, the owner was trying to pull it out, but it could not come out. So the good thing is just contact your vet immediately. So for prevention of such foreign bodies consumption happening, you need to remove the unsafe items and keep them safe, especially if we have a puppy or a kitten or just a pet at home. You need to keep them safely. You have to buy appropriate chewy toys. Like the cats love anything that is like a string. Like this kitten was playing with a needle with a string. So be careful when you choose the toys. If it's a dog and you're buying a ball, it should be sizable enough that the dog cannot swallow it. And if you have the garbage, we have those animals that is scavenge, so you have to keep the rubbish away. And if you're going out on a walk, make sure your dog or a cat is on a leash so that it doesn't get those foreign materials anyhow. That marks the end of our presentation today. And thank you so much for your time.
All right, thank you so much, Dr. Mercy. That was quite informative. A lot of things that we didn't really, maybe may not even have thought of. Things like the last slide on swallowing foreign bodies and things like that. The session is open for questions for anyone who might want to ask. So my first question, Dr. is, sometimes in poisoning cases, we see the use of vitamin K as an injection. What does that do for the pet, and how should it be then used?
Okay, so vitamin K is mostly used in cases of rodenticide poisoning. I didn't mention it because you can't administer yourself vitamin K at home, but it is normally an injection. It is used in cases of rat poisoning because of most of the rat poisons, they have that issues with coagulation, like your pet is bleeding anyhow and it can't really clot, because most rodenticides, they have a chemical called coumarin. And coumarin, when it is consumed, like your animal the blood cannot clot. So that's why we administer vitamin K to help in the blood clotting.
Okay, so it's not just for all cases of poisoning.
Not for all cases, actually not for every rodenticide, because there are some rodenticides that are not actually coumarin.
Okay. Then we've also seen cases of poisoning due to use of shampoos, and especially on cats. Would you mind giving a word on that?
Yeah, so shampoos, actually, what I need to warn our clients or pet owners is that not every shampoo that is safe, and a shampoo that is prescribed for dogs cannot automatically be used on cats. And we've seen cases, especially of dudukrin. That's what I've seen in our clinic, the dudukrin for dogs.
Yeah.
A cat is poisoned. Like, if it is not written on the label that can be used in cats, please don't use it.
Okay, so the common substance there is pyrethrins, right? The shampoos that contain pyrethrum-based products.
Yeah, pyrethrum and even organophosphates, you cannot use them.
Okay. And so if that happens, what should we do immediately at home?
So if that happens and you know it is a shampoo that has caused it, as I said earlier, we have dermal exposure, the exposure of the skin to a poison. This is a poison in this case. What you need to know to do is to wash with a warm, clean water, just plain water, to rinse it off completely. And if it is started showing signs, because sometimes you can wash your pet and it leaks it such that it has already ingested, you have now to follow the slide. You remember that slide on if the pet has ingested that activated charcoal, giving the milk and using dilute hydrogen peroxide to induce vomiting, just to prevent further absorption.
Okay. Yeah. As I come to my last question, let me first ask, Lina has a question here. And if you don't have activated charcoal, then can you use normal charcoal? Is there a difference?
You can give the normal charcoal. Actually,
Okay,
there is one who just literally went to the maca and used it even before she came to the clinic, and it really helped.
Okay, that's good to know. And my last question is, we see a lot of people asking for painkillers, and I saw that you mentioned the use, the poisoning through use of paracetamols and such tablets. A lot of people ask whether they can give painkillers as first aid. What should, I mean, for cases where there's obvious pain, what do you then recommend?
Yeah, so for paracetamol can really cause a very bad kidney problems, mostly in cats. And the safe medication for pain at home for cats is meloxicam.
Yeah.
And we also have tramadol. Those are safe painkillers, but you have to give as per the weight of your cat. You have to know the weight of your cat and ask your vet, how much do I give before you give?
Okay. There's a question from Susie. She says she might have missed the list of the first aid kit. So do you mind showing that again? If you can go back to that slide. In the meantime, if anyone else has questions, please ask in the chat, or if you raise your hand, I'll unmute you and you can speak. Okay. So that's, if you can see the list on the side, on the screen, that's the first aid kit to create. So I'll let that sit on the screen at the moment. And then I see someone wants to ask a question. Lindsay, go ahead.
Hi, Naomi. Hi,
Hi.
Doc.
Hi.
Thank you so much for the informative information. Everything is quite timely. Especially, I just recently asked a vet about what to have as a first aid kit at home. So this is fantastic. Now, my question is, there's something I saw about hydrogen peroxide in one of the slides, to saying not to give. I didn't quite understand why not to. It was there in brackets somewhere on
Yeah, it was on wounds.
yes.
It was in wounds,
Yes,
especially. It was under fight wounds actually.
yes.
And for this was it was this one.
Yes, there I see it. Disinfecting
it
wounds and
was
not
this
use.
one. Yeah, for disinfecting wounds, we say
Okay.
that for fight wounds especially, you are not to use the hydrogen peroxide. Why? Because it actually corrodes the tissues.
Okay.
It corrodes the tissues, and this will delay the healing. I know we have used it in managing abscesses, but this is a fresh wound. You have just seen your dog has been bitten by another dog. You don't use hydrogen peroxide there.
Okay. Okay, I've seen.
Neither do you rub the wound.
Okay.
Yeah.
So safe to use is either saline solution. How about iodine?
Yeah, actually from that slide, let me just go back. We said you need to, the one you can use is just betadine. Let me get
okay,
to that.
betadine. Yes, okay.
Yeah, you use betadine, you can use Dettol, you can also use the chlorhexidine. I'm sure all of us know chlorhexidine.
Yes.
No, we don't.
Chlorhexidine is Savlon. You know Savlon?
Yes.
Now we know. My dad has two cats who've always been together, but sometimes they fight. One has suddenly in its own old age seems to not be very friendly. There has been a behavioral change and keeps attacking the other one. So I know that sometimes he has reached out for the hydrogen peroxide. I'll make sure I tell him about this.
Okay. Yeah, tell him.
Yes.
Yeah.
Okay. Thank you very much.
Okay, you're welcome.
Thanks, Lindsay. I have another question from Sarah Jamal. Sarah, please go ahead.
Hi. We always hear about giving raw eggs to poisoning cases. So is that correct thing to do, or we should not do it?
Yeah, so that's a good question, Sarah. Raw eggs, the egg yellow, the yellow part, it has some antioxidant, and that one has helped especially with the oxidation mechanism of some of those poisoning chemicals by giving the eggs that contain some antioxidants. It really helps to control the signs. So raw egg can help also.
Okay.
Yeah.
All right, there's a question from Zahra. If Savlon is safe, is Dettol also safe? Because it's been listed in some places as a toxic substance.
You don't use it directly. If you can dilute it with little water.
Okay, so the same for Savlon.
The same for Savlon. You have to dilute it. Even betadine, you have to dilute it. You don't use directly on the wound.
Okay. All right. And for the other question from Zara, she was asking where you can get activated charcoal. You can easily find it in a pharmacy.
Yeah.
All right. Anybody else with questions for the vets in-house? Any comments or suggestions or additions? As usual, my co-host is Karen. She says hi.
Hi, Karen.
All right, nobody else has questions or additions. So thank you very much, Dr. This has been quite informative, and we hope that we can really be able to help our pets if they're in these situations. But more importantly, we hope that we can prevent them in the first place. For those, let me just share something. For any contacts you want for Dr. Mercy, her contacts are here on the screen. So you can always find her at Petville, where she's the leading vet. And all these details are available on the Petville website and on their social media pages. You can find her there. And for ourselves at the podcast, this has been our 4th session. We took a break a bit due to the election period. So thank you for being with us and keeping up with what we're presenting. We hope we can have many more productive sessions like this. So we're back to every Monday's schedule, and our email address is thepodcastkenya@gmail.com. We don't have a very strong presence on social media yet, but we are on Facebook, and the recordings of each session are actually available on YouTube. This one will be uploaded tomorrow, so you'll be able to find the same tomorrow. The other 3 sessions previously are already online on YouTube. Thank you again, everybody, for taking time to be here. This is very much appreciated from me. And that's it for the evening. Enjoy your evening. Enjoy the rest of your week.
Okay,
Thank you very much.
All right.